Hi, I'm Aislinn Cook. I'm a Senior Research Fellow at City St. George's in the Antibiotic Policy Group within the Institute of Infection and Immunity. I've been working here for about 8 years, working on a range of projects including clinical trials and data reuse projects looking at optimal antibiotic use, so in the hospital setting, in primary care, and also thinking about national antibiotic use and how we should use data better to improve antibiotic use. So our group, led by Professor Mike Charland, has been working with the WHO for a number of years. Professor Mike Charland chaired the Essential Medicines List Committee that developed the AWARE system. So the AWARE system was developed in 2017 to categorize antibiotics. There's a huge number of antibiotics into groups for access, ones that we need to watch their use of, and reserve ones that we should use only when required. And this is built as a stewardship tool, which was then turned into a guidance document called the AWARE Antibiotic Book, of which Professor Charland was also an author on. And our work as a collaborating center is really building on this base of which we've already been working with the WHO for a number of years on using and improving antibiotic use, with a real focus on access to antibiotics and effective antibiotics. So our collaboration as a collaborating center will entail maintaining and helping to inform updates to the AWARE system, so which antibiotics should be in which categories. It will also include kind of updates to the AWARE book, so where there might be new evidence to inform treatment choices for different infections in primary care and hospital. We would provide guidance and data for that, as well as then thinking about how we should use data better. So the WHO has the GLASS antibiotic use surveillance system, which countries report their data into, while also supporting hospitals doing point prevalence surveys to assess their antibiotic use, and thinking about how can we measure antibiotic use in primary care settings, particularly in places that don't have a lot of electronic records. So our collaboration will really be thinking also about how we can better collect and actually use those data from these settings to inform targets of antibiotic use, as well as quality indicators to actually improve prescribing for patients in these different settings. So antibiotics are a modern medicine miracle. They allow us to treat infections effectively, as well as have a range of access to other types of care that really rely on preventing and treating infections. But accompanied with our use of antibiotics, it has been resistance to these different antibiotics by different bugs. And this burden is really felt predominantly in low and middle income countries, but it really affects all of us. And so our work is really trying to think about how you can improve the use of antibiotics, and that to ensure that all patients have access to effective treatment that they need for their infections. So in some settings, this might be focusing on improving use, so reducing antibiotic use where the antibiotics are being used unnecessarily, or making sure that the right choice of antibiotic is being used for those patients, as well as thinking about where in hospital settings where there is a lot of resistance and there is mortality, making sure that those patients get access to the drugs that they need and ensure that they can be treated for their infections.